Congressman Ferguson.
Thank you for listening and thank you for your service to our district. My name is Valerie Haskins. I'm a teacher, a mother, a grandmother, and a member of Indivisible 3rd District. As a resident and a constituent of yours of Manchester, Georgia, I am making this video to express concerns about the possible vote on repealing or undermining the ACA. As you know, there are 28,900 people insured under the ACA in District 3. This is according to the Kaiser Foundation. These people are your constituents, Congressman Ferguson. Decisions you make affect their lives, their health, and their families. This should weigh heavy on your decision making, which I'm sure it does. 26,400 of these enrollees have advanced tax credits and 19,300 have cost sharing reductions, according to the Kaiser Foundation. According to the Congressional Budget Office, millions will be uninsured if the ACA is repealed. I want to ask you to listen to the video. Okay.
Yeah, this is Richard Ferguson from Warren Springs, Georgia, Mayweather County. We're talking about the affordable Obamacare. I think we really need it because it's some kind of situation like this, we need health care. I'm saying, for example, that my wife was diabetic, and so she had to go through a lot of medication, different insulin and whatnot, and so we need this to her survive. And so also, I retired in 2014, and so at the time I was getting ready to retire, I wouldn't have had no insurance. And so the insurance I had from my company job, I couldn't afford to pay for the insurance. And so during that time, about 3 or 4 months before I retired, Obamacare came in. And that's what saved me to able to retire. So I don't think you should take this away because so many people need this health care. And so we need this very, very important to us.
Hi, my name is Janice Ferguson. I'm from Warren Springs, Georgia, at 235 Palm Street in Warren Springs, Georgia. I had a stroke in 2016, June 17. I had to go to the foundation for 21 days. Obamacare saved me. When I left the foundation, I didn't have to pay not one quarter. I thank for Obamacare, and I think we should continue to keep Obamacare.
Senator Ferguson, I am Dr. Haskins. I'm a retired family doctor and I live in my hometown of Manchester, Georgia, which is where I practiced medicine after 1996 when I left the Army. I practiced overseas in Germany, and then I came back home to open up a medical practice here in Meriwether County, which is part of the 3rd Congressional District. I am in this video to tell you why I believe that we need to keep and improve the Affordable Care Act as opposed to replacing it and repealing it. In 2013, the year before the implementation of the ACA, there were 44 million uninsured adults residing here in the United States. That number dropped to 27 million in 2016. Also, Medicaid enrollment gains caused the rate of the uninsured non-elderly persons to decline from 16.6% in 2013 to a historic low of 10% in 2016. As you know from your medical practice, uninsured individuals are less likely to receive preventive care or follow-up care on chronic diseases. Uninsured adults are 3 times as likely as adults who have insurance to postpone needed follow-up care or obtain medications, primarily because of cost. Uninsured individuals are more likely to be hospitalized for avoidable health problems and are more likely to experience worse outcomes in the hospital, including death. We are in the profession dedicated to the health and welfare of our patients. Dr. Ferguson, Congressman Ferguson, you are in a unique position, an even more influential position. You are a legislator, and you can help make policy that will substantially improve the quality of life for all Americans. This is not the first time that you and I have corresponded, and I thank you for the individualized letters that you've sent me regarding health care. We agree on some things, that the patient-doctor relationship is paramount, and that we agree that actions are necessary, in your own words, to correct the unfair and unequal tax treatment between Americans who get their coverage from their employer and those who purchase their coverage in the individual marketplace. However, I assume that you are opposed to Medicaid expansion, as you state in your letter dated 6 April 2017, quote, "I supported the American Health Care Act in that it would produce $880 billion in critical savings to the Medicaid program. I hope that I am incorrect in this assumption, given that the Kaiser Family Foundation determined in June of 2016 that 1. Medicaid expansion improves the affordability of care and financial security among the low-income population. States expanding Medicaid under the ACA have realized budget savings, revenue gains, and overall economic growth. States' general fund spending growth for Medicaid has been slower in expansion states compared to non-expansion states. Most studies show that the Medicaid expansion had a positive effect or no negative effect on employment and the labor market. And finally, Medicaid expansion allowed state-run clinics as well as private clinics and private hospitals to recoup losses that they would have faced had these folks not had Medicaid. In other words, they were able to get reimbursed more for care that they used to not get paid for because these folks were not insured. Now, you and I completely diverge on the issue of employer and employee mandates. Although it's vilified by many, the mandate is attractive for several reasons. 1, it is easy to implement. 2, it's enforceable. 3, it is effective in pooling risks. And it reflects the value of individual responsibility, and coverage is primarily funded by the enrollees rather than by taxation. One of the failings of the ACA was that the individual mandate failed to pool risk adequately, in large part because its penalties were too weak. Germany, Switzerland, Singapore, and the Netherlands have achieved universal health coverage and made insurance affordable even for their citizens with the highest health cost, simply by instituting an individual mandate. One major difference, though, is that unlike the ACA, the mandates instituted by these countries are reinforced with effective penalties for non-participation, thus ensuring that lower-cost enrollees, who are generally healthier individuals, balance out the cost of others who require more medical resources. As an aside, I had the privilege of working alongside my Dutch colleagues and my German colleagues back in the early 90s, and I was impressed with both of the nation's healthcare systems. A few last things. According to the Kaiser Family Foundation, approximately 29,000 people in your district, the 3rd Congressional District, face losing their healthcare insurance coverage should the ACA be repealed. I know that this is unacceptable to you. Furthermore, tax credits to help offset insurance costs are not going to help the people who are living paycheck to paycheck. It's simply time for the United States to face the music that it is time for us to join other nations that provide universal health care coverage. It is achievable, and we can do so by cherry-picking the best attributes from other nations who've achieved the same thing. And we can do so without having to go to a single-payer system. The argument that the ACA caused healthcare costs to skyrocket is not valid. Costs were skyrocketing before the ACA even went into effect. As opposed to repealing the ACA, let's find ways to improve it. As a physician and as a constituent, I urge you to vote no on repealing and replacing the ACA. I would very much like the chance to discuss these issues with you in person at a future date. I'm sure that both of us would gain much from such a meeting. Should you have the time, please feel free to contact me via my email, wckhaskins@email.com, or via my telephone number, 706-977-0091. I thank you for your time, and I wish you, your family, and your staff all the best.
Hi, Congressman Ferguson. We're here today with Frank Barber of Manchester, Georgia,
And I just met Frank yesterday at the gym, and he has a powerful story, and I want him to tell this story to you.
Hello, Mr. Ferguson. I'm Frank Barber, and I met her at the gym, like she said, and I had an experience about a month and a half ago. I went to a hospital. I don't know if I'm allowed to say the name.
Yeah.
St. Francis in Columbus, Georgia. And I got there at 4 o'clock in the morning on, I think it was Wednesday morning. And when I went in there, they took me in about 15 minutes. I had 2 nurses talk to me, asked me questions. They looked at my leg. It was swollen up. I mean, it was really beyond, it was bigger than what it's supposed to be. And I was in there about an hour. And one of the questions they asked me was, did I have insurance, or what was my copay, or whatever? And I told them I don't have any insurance. I work across the street at Big T Tires. And they said, okay, that'll be fine. And I was there about an hour and a half, and they brought me out. They brought me a piece of paper to sign, and they gave me my medication. Told me to take this medication for 2 days. If it doesn't work, go see a doctor. Okay? Well, I took the medication for for 2 days, and my leg got worse. Okay? And I came home and I took pictures of this. And on the 3rd day, when I left the job, my boss was concerned, and she's her name is Miss Tucker. She's the owner of the business. She was worried about it. She told me go to the medical center in Columbus. Okay, so I went home that night, and my daughter happened to be here. She gave me a cane. She said, you need to go because they didn't do you right. I'm telling you, something's wrong, Daddy. So we loaded up about 7:30. We got down there about 8:30 in Columbus, Georgia, because I live 40 miles away. As soon as I went in there, they checked my leg, took my heart rate, and in 15 minutes I was took back. But I forgot to say this. At St. Francis Hospital, not one doctor came see me. Looked at me, talked to me, shook my hand, or anything. Just sent me on my own. Okay? But I went in this hospital. I had 2 doctors come in and look at me, and they admitted me. They told me I was fixing to have septic shock. I was that far ahead. I could have died from it. I think everybody needs affordable insurance.
Thank you, Congressman Ferguson, for taking the time to listen to these constituents, listen to their concerns.